Assalamu alaikum wa rahmatullahi wa barakatuh. We thank everyone for joining us on the 6th night of Ramadan. We are live at Albayan Studios, joined by our dear guest, Dr. Yusuf. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum salam, Dr. Omar. Nice to be here. Jazakallah khair for having us.
Wa yakum inshallah. Now, for those that haven't met Dr. Yusuf before, may Allah subhanahu wa ta'ala reward him. He's joining us today. He's a general practitioner and also a hair transplant doctor. And inshallah, during the course of the program, we'll shed light on some of the interesting things that you do, subhanAllah, in your day-to-day and your medical field. May Allah make it easy. I want to jump straight into it. We're going to speak about, obviously, health issues within the community. We did go through some topics, and there was an obvious one of obesity. So can you give us a bit of insight into what is obese? Because when we look at statistics, it looks actually it's quite high in Australia, and we're talking above 60%. And for those that they should know, that obesity leads to a huge variety of medical conditions.
That's 100% correct. It's something that we see every day. Unfortunately, it's a pandemic in our community. Majority of patients I come across suffer from being overweight or obese. And it's quite unfortunate because we know that our body is an amana and we have to take care of it. And it's due to a variety of factors, including just poor lifestyle choices and I think some cultural things that we do, such as like eating dinner late at night, eating a lot of greasy, carbohydrate-rich, fat-rich foods, and I guess a lot of the community are blue-collar workers and are just very busy and don't have time for exercise, and that's absolutely critical.
And generally, that we find that we're not as active, obviously, as we used to be. So it's not just about what you eat, it's also your activity level. And what we also, subhanAllah, find is when there's one or two people sort of that have an obesity problem, it's not really an issue. But when everyone in the family and relatives and family all have the same, what they normally reference to as what they call the BMI, if everyone's pretty much the same, then when it becomes a norm, then no one's really obese in that.
That's 100% correct.
That circle.
That's right. That's what I see. Everyone's overweight. Everyone's obese, and you think you're normal. And I tell my patients, you have to lose weight, and they're like, I'm not fat. But it doesn't help when the doctor's a little bit overweight as well. So we have to work on that too. But no, it's definitely something that we lack a lot of awareness in the community. And a lot of patients will say to me, and this is a joke, a lot of patients say to me, obesity runs in my family. And I'll tell them, no, the problem is nobody runs in your family.
Yeah.
So I think exercise is we're a very sedentary lifestyle these days.
Yeah.
We use our cars, we're sitting on the couch watching TV. Everything's at the access of our fingertips on our phones, Uber Eats. And so, yeah, definitely it's a product of what we're eating and the lack of exercise, lack of output of energy.
Before we move on, just want to remind the brothers, for those that want to send a message, for the WhatsApp, 0481 342 582, or whatever platform you're listening to, either YouTube, Instagram, Facebook, whatever it may be. You can also send questions and comments. I just want to clarify before we get into the topic of obesity and the related conditions. There is two types. There is a eating obesity caused by eating, and there's obesity which is caused by, could it be genetics or could be some underlying problem, because sometimes people they say, oh brother, stop eating, or you're eating too much, what's your diet? And he says, I don't eat a lot. And some people barely eat and they put on weight. So is there a type of obesity that could be genetic, and no matter what a person does, it just doesn't?
Look, excellent question. There are definitely a variety of factors that would lead to someone being overweight or obese. Probably the biggest factor is what we see the most is lifestyle choices. That's the biggest. However, there are other health issues that can cause someone to be overweight or obese, some of which include things like hypothyroidism. So if your thyroid is underactive, you'll just naturally just gain weight, as well as a variety of other symptoms, including feeling cold while other people feel they're hot, and feeling very tired and lazy.
And I've heard certain medications also can cause.
Definitely. Medications probably one of the very common causes. And this is the thing, right? Anything that you put into your body has some positive effect and may potentially have some side effects, and that's something to discuss with your doctor. And it's a balancing act where we have to calculate if the benefit outweighs the negative. But definitely a lot of medications can cause weight gain. Common medications such as antidepressants, such as some anti-seizure medications, antipsychotic medications for some mental health disorders, and a variety of other like chronic pain medications. These can a lot of them can contribute to weight gain, definitely. Other things that can also contribute, for example, some females might have something called PCOS, polycystic ovarian syndrome. It's very common amongst all women. And that can also cause something called insulin resistance, and it can make it more difficult to lose weight. And it's very important to be empathetic to someone who's overweight or obese, and it's very important for anyone that's experiencing being overweight. Like I said, it's something that I suffer from, something that a lot of people in my family do suffer from, a lot of my patients suffer from. It's not something to be ashamed of. It's something to be open about, to acknowledge. When you understand that you have a problem, that's the first step. And then once you've understood that you have a problem, the next step is seeking help. And there's a Islamic principle where you ask those of knowledge if you don't know something. So go to your medical practitioner, go see a dietitian, go see an exercise physiologist, and discuss with them what strategies you can do. Start with a blood test, and then start with a strategy on losing weight.
Because I remember once a doctor was telling me there was an issue with a father that kept beating his son, and he kept on saying, "My son is overweight. He doesn't stop eating," and he kept on berating his son that he's overweight or whatever. And when the doctor done all the tests, he found that they had the thyroid, hypothyroid. So he said that it's not your son's fault. He does have a. So the treatment is there, but it's not about not eating. It's about getting the right.
Look, with medicine, the right way to approach it is a biopsychosocial model. So there is biological causes, there's psychological causes, there's social causes. A lot of people, unfortunately, emotionally eat out of stress. And the community is going through quite a stressful period of time at the moment with what's happening to our brothers and sisters overseas in Palestine. So a lot of people have come in and seen me with exacerbation of mental health issues and stress. Because of that, seeing what's happening on the news and suffering because of that, and overeating is a mechanism to cope with that.
Divorce is another issue. There's a lot of problems.
Problems, definitely.
Comfort.
Definitely.
They use food as
a comfort. Exactly. So the best way to address obesity, everyone is different, and I have to say that a young man losing weight, generally speaking, is much easier than an older person or especially an older woman losing weight, because hormones come into play as well. So around the menopause age, it becomes very difficult to lose weight as well. And that's something that people have to understand and empathize with, because some people will tell their mother or tell someone in their family, look, I just went on a diet and I lost weight. But not everyone's metabolism is the same. Not everyone's basal metabolic rate is the same. Not everyone can burn the same amount of calories. And a lot of people can't exercise at the same intensity that a young person can exercise at because of problems that have come across from
mentioned about
obesity.
antidepressants. There are some people that have to go on it for, and you're talking about proper reasons, or even seizures, anti-seizure medication, and then they've put on weight, but they're too embarrassed to tell people that this is the reason why I'm putting on weight. What are they going to say? Hey, listen, I'm on I've got seizures, or hey, I've got depression.
That's
so
right.
generally, the effect is there, but then they have an embarrassment of telling people, what's occurring.
Well, there's actually a medication much more common than both of them, and you'll be shocked. And think about it this way: haven't you always heard the story where someone just gets married, and then for some reason, the young lady's gained like 10 or 15 kilograms of weight?
Yeah. Talking about like the contraceptives.
That's right. Yeah. There's some contraceptives cause a lot of weight gain, and that's something to be aware of. Different contraceptives, from the oral contraceptive to even the Implanon. So different contraceptives can have side effects, including weight gain. So
and
something to be aware of.
Stop smoking for some reason that also.
Well, so some people use smoking as an appetite suppressant, and I'm extremely anti-smoking. I think it is the biggest scam in history. Not cryptocurrency, smoking. Okay, it's mind-boggling that
at least the cigarettes only go up in price.
Yeah, they only go up in price. Exactly. But I can't understand how it's acceptable or legal to sell something that's addictive and is evidence-based that it kills you. So it will kill you eventually, and I don't think that there's any doubt that it's something that's not really permissible in our faith either.
I remember when I was doing a bit of research in regards to World Health Organization, and they said that generally in the 80s and 90s, most people died from infective diseases like malaria, viruses, tuberculosis, whatever. And in the early 2000s, there was a big shift, where now the majority of the world dies from metabolic diseases, which is in a sense related to what we're talking about, obesity. So obesity gives rise to diabetes, heart attacks or heart disease, cholesterol, peripheral vascular disease, hypertension, blood pressure, and high blood pressure. So talk a little bit about like with obesity in itself, and we are discussing the one that is related to food and controlling yourself and what you eat. That the effect is far worse than just someone putting on weight. And it gives rise to things that can lead to people's ultimate, just like you said, that cigarettes is haram because it leads to obviously someone's death. Again, obesity can bring about so many complications.
Definitely. We could talk about this for a very long time. There's so many. I can't think of any disease that is not contributed to by obesity. Like any disease I can think of, there's obesity plays a role in that disease. Even
cancer?
Even cancer, that's correct. So obesity is definitely a contributing factor to cancer. So and that's something that you can look up. That's something that's well studied, and that's something that everyone's afraid of, cancer. But your lifestyle choices is definitely a contributing factor. It's probably one of the larger contributing factors, believe it or not. Another big one actually is, and we talked about weight gain, and it happens with men as well after marriage, is depression. So when you gain weight, your testosterone drops. And a very common, like I have a lot of young men or older men, they come to me and they're feeling low, they're feeling tired, they have no libido, and we check their testosterone, it's very low. And the reason is because they're overweight. So losing weight is absolutely critical to your testosterone and to your libido, to your vitality, your well-being, and just your overall mood. If we want to talk about other diseases,
diabetes is a big one.
Yeah, so diabetes is a massive one, and you see a lot of diabetic patients as a podiatrist.
I think statistically is 1 in 5 are diagnosed with diabetes, and majority of people that are diagnosed don't even know they even had
that happens. That happens a lot.
Had diabetes, and where from the podiatry perspective of it is because diabetes affects the blood circulation and the nerves, what they call peripheral neuropathy, the skin, everything pretty much in the body. And the first of the symptoms that sort of come to show occur in the feet, and that's where obviously we come in assessing to see if there are any signs of diabetes sort of taking a toll on either the nerves or the blood circulation of the body. So that's how our assessment comes in. But generally, it's something very common that even the Medicare or the Australian government are scrambling to find ways to prevent it and to also treat it. And it's very difficult to, especially some people have it for 15, 20 years and don't even
that's right.
Don't even know.
That's right. I get that all the time actually, and this is, I think, a good reminder for our viewers that if you're feeling unwell, if you're feeling tired, if you're feeling that you're always thirsty, if you're feeling like you're always urinating, if you're finding large fluctuations in your weight, it's definitely a good idea to go to your local doctor and get a checkup, get a blood test. You'll be surprised. Now there's actually a new phenomenon of very young people getting diabetes. We're talking about teenagers. Type 2 diabetes is what I'm talking about. And it's directly linked. There is a genetic component, but it's also directly linked to the lifestyle choices that we have. And like you said, I just pulled up a statistic that diabetes does contribute to many increased risk for many types of cancer.
So is diabetes and obesity directly related?
Definitely, there's a causation and correlation of being overweight and having poor lifestyle choices and getting type 2 diabetes, definitely. And so, for example, I have diabetes in my genetics, it runs in my family. So it might, inevitably, I may develop diabetes. However, if I have good lifestyle choices and if I'm healthy and if my BMI is in a healthy range, then I may prevent that from ever occurring, or it may occur very late in life and be a very mild form of diabetes. Whereas if I have bad lifestyle choices, and I've seen it in my own blood tests, and I've monitored my sugar levels, I might develop diabetes a lot sooner, and it might be a lot worse, and I'll get a lot more complications because of that.
Yeah. And you really have to speak to someone that lives with diabetes to understand that it's a very hard condition to live with.
No, definitely, it does become a bit complicated, and I think it's a very nice privilege when patients come to me and they say to me, "I don't like taking medication," and I said to them, you're very lucky up to this point in your life, you haven't had to take medication. And probably the only way you can maintain that is by being very, very healthy. But unfortunately, once you get some of these diseases, you need to control them with medication. Otherwise, they tend to deteriorate and they end up with much more long-term complications. But in saying that, if you control your diabetes very well, if you have a very good diet, if you exercise regularly, then you can avoid many of the complications and problems that you develop with diabetes. And also, it can be reversed in some circumstances. So there's a phenomenon of a lot of people reversing their or no longer having diabetes after going through the gastric sleeve. And that's not only because of the gastric sleeve per se, but it's because of the large amount of weight loss that they've had after the surgery. So it's not a final catastrophic diagnosis. It just means that you need to. This is a big wake-up call, and you need to really fix up your lifestyle factors and.
So is diabetes someone eating too much sugar? It's not necessarily the case, is it?
No.
It could be just bad diet, bad exercise. Like it's the balance, right? You're not eating and you're not
burning those calories.
You're not burning those calories.
Right.
You're not exercising.
That's right. Yeah.
And obviously there's a measure. And, obviously the fitness guys will tell you, how much you have to burn and things like that. But generally, like you said, because we don't live that active lifestyle. Because we hear stories of the companions eating like pure fat from the sheep or the lamb, like literally like fat, but they'll say that
on
would,
the rare occasion
that would burn off very quickly.
Oh, for sure. And it was, I think it would be rare as well. They'd go like months without eating meat.
Yeah.
You know.
So there was obviously like
it's a luxury
program. Yeah.
It was a luxury. I think historically meat has been a luxury.
Yeah.
And all the carbohydrates
But
that
if
we're
eating it every day,
we're eating it every day. If we don't have a proper 3-course meal at dinner, we feel like something's wrong. And I don't think that's how we've been designed to eat, and that's not how we've historically eaten.
So would you also say that in regards to obesity and diabetes, a lot of people have these fads like fish diet or vegetarian diet or whatever. In Islam, nothing's prohibited to eat. Just you have to have the right balance. Like some people say, I'm not vegetarian, but I'm not eating meat for the next 3 months or 6 months. I'm trying to lose weight. But what we learn is that can also be harmful in a different way.
Yeah,
and you have to have the right. But that's why we have dietitians, obviously, and medical health professionals, because you need the correct balance. But what might be correct for one person might not be correct for someone else.
I 100% agree. I always am an advocate for long-term lifestyle change rather than crash diets.
Yeah.
A lot of people go through these crash fad diets and shakes or keto or this or that. And unfortunately, they get some rapid weight loss and then they regain it afterwards. And the problem is the long-term adherence to such a diet. In saying that, there is exceptions, and if someone needs to get that kickstart to weight loss, if they can, do some caloric, they can do some changes like intermittent fasting and caloric restriction and reducing carbohydrates and so on. And if they can maintain that on the longer-term level and make some more healthy lifestyle choices, I do think that's a good idea. Generally, what I advise my patients is some simple principles that I find are very helpful is not eating at night. That's a very important principle because when you eat at night, you spike your insulin just before you go to sleep and you're not burning off those calories.
Yeah.
So I usually advocate for at least 3 to 4 hours before going to sleep to be fasting and just drinking water, essentially. Yeah. That's for me is a very big thing that I advocate for my patients, and I've tried it on myself and it's helped a lot. Also, it's imperative that we try to do at least 30 minutes of exercise a day. 30 to 60 minutes of exercise a day. And it's very important to also try to do incidental exercise. So things like parking your car far from work and then going for that walk, or, walking to the masjid, or, just doing extra steps instead of taking the elevator, doing the steps. So these little things.
And these days we can count our steps. So
exactly. Exactly. And these little things make a big difference. They raise your general basal metabolic rate, and you start to burn calories throughout your day. If you have a desk job like I do, I sometimes try to get up, do some push-ups, and then have a seat.
Standing desks.
Standing desks and moving. So sometimes if my patients think, well, why is the doctor taking so long? It's probably trying to do some push-ups. I'm quite slow at them. But yeah, it's important to try to break up your day with some exercise. Definitely. It makes a big difference. SubhanAllah.
Just want to remind the brothers, 0481 342 582, or they can leave a comment on Facebook, YouTube, Twitter, whatever platform that you're listening to. Dr. Yusuf, with obesity, diabetes, we said it's highly related and it's very, very common within the community. Something we do hear about a lot, and we've heard a lot of stories of person just cutting the grass or going to work or just going for a stroll. I know of members and neighbours that we know, probably 3 or 4, that this happened to. Heart attacks, sudden death. And this is something the Prophet ﷺ spoke about towards the end of time. Sudden deaths will be prominent, and people will just die suddenly. And this has happened.
I'm seeing it very frequently.
And age is no longer 50s, 60s, and we're hearing it in 30 and 40s.
No,
healthy people too.
Yeah, 2 or 3 days ago, a patient of mine, a Syrian gentleman, very nice guy, he developed chest pain and then went to the hospital, and he found out that he had a complete occlusion of one of his blood vessels. It was completely blocked. So he'd caught it just before having a heart attack, and he needed open heart surgery at the age of 40. So which is very unfortunate. That's very young. Back in my grandparents' time, my grandfather also had open heart surgery, but 60, it was in his 60s, late 60s. So I think our lifestyle choices are playing a absolutely.
And this is all to what you eat, because it develops plaque in the arteries.
So what you eat is probably one of the biggest contributing factors. So what you eat, so obesity, definitely. Your lack of exercise, smoking is a huge one. And I think we'll touch about this a bit later on, or we can touch about it now. What do you prefer?
I think it's important people.
Yeah. So look, smoking is a huge problem, and it's become a bit of a third world problem, believe it or not. What do I mean by that?
Is that because it builds like blockages, or
you'll be shocked.
Or it doesn't? It stops the.
It contributes to everything. It contributes to everything. It causes microvascular disease. And macrovascular disease. It's basically you're putting toxins into your body. If you look at the constituents of what cigarettes contain, there's actual toxins in there. And it's addictive, and it's carcinogenic. It enhances cancer, and it causes diabetes. By the way, it does cause diabetes. It contributes to a lot of different diseases. And what do I mean by it's a third world problem? When you go to third world countries, there's a lot of people smoking, including doctors.
Yeah.
And it's very, very common. I won't mention which country, but I went on a medical stint overseas, and in the hospital, there was a sign saying no smoking, and then there was 3 doctors right next to that sign smoking. I found it quite ironic. But in Australia, it's becoming less common, and unfortunately, it's becoming a phenomenon that's seen mostly in low socioeconomic status populations. So people that have a lower income, a lower education are still smoking, whereas most other Australians are starting to stop smoking and just being healthy, having healthy lifestyles, having healthy food choices. So I think that it's something that people should definitely try to quit. And look, a lot of people will tell me that I've been smoking all my life, I can't quit. But I've seen many times when patients have a heart attack or have a stroke, all of a sudden they've quit cold turkey.
It's a bit too late.
Yeah, it was
damage is done.
The damage has been done, but then they've stopped further cumulative damage. So it's definitely still beneficial.
What about the argument? Someone says my grandma was 90 and she was smoking.
I love that argument.
And then I normally say she could have probably lived to 100.
Yeah, I like that. That's right. That's 100% right. Exactly. Who knows what she could have done if she wasn't smoking? Number one, but number two, there's always exceptions to every rule. Medicine works based on scientific evidence. It works based on studies, based on statistics, not just anecdotal
and there's
stories.
Always exceptions.
There's always exceptions to everything, So as a general principle, I think the evidence is extremely clear that it's harmful, that it causes a variety of different diseases, and not only that, it causes a bad odor. It stains your fingers. It causes aging. It causes wrinkles. It wrecks your teeth. And if one is advised not to come to the masjid if he has a smell of garlic, how about cigarettes?
Well, I've heard they said cigarettes resembles exact attributes of the devil. Right, it's made of fire. It's addictive. It smells, and it keeps righteous people away from you.
There you go.
Which, in a sense, is saying that SubhanAllah has the same attributes of what the shaitan has. It's made of fire, it smells, it's disgusting, and it keeps the good people away. And if I see someone smoke, I'll move away. And a lot of people do exactly the same thing. then again, يعني, subhanAllah, these days people are moving. Yeah, they are still smoking, but now they're smoking
vaping and stuff like that.
vapes and other.
Look, do you know what's interesting though, Ahmad? I would say is that not only is it bad for you,
It's bad for others. Yeah.
it's bad for your family, and that's the thing that gets me, because passive smoking is a real thing, and there's harms from people smoking around you, and it can affect your children, it can affect your wife, it can affect just strangers. So that's something to keep in mind as well. And also the financial aspect. I love using the financial paradigm with patients. If you think about how much you've invested on cigarettes, usually it's $6,000 to $10,000 a year, and you invested it in Bitcoin or gold or a property or whatever you liked. By now you'd have a few $100,000 minimum.
10,000.
Or sadaqah, exactly.
10,000 builds a masjid in Africa.
Exactly, that sponsors at least 20 orphans. You know,
yeah, subhanallah.
that's
So
crazy.
yani, the benefit is there. So with smoking, and so it does have a direct relationship with
With
coronary.
all the diseases we talked about, coronary artery disease, strokes, cancer, diabetes.
And now, have you heard? And I just, because obviously in the medical field, I've heard of surgeons refusing to operate on patients
Definitely.
that would not or don't quit smoking.
Definitely. Even with hair surgery, when I perform hair surgery, my patients have to quit smoking at least 2 weeks before, 2 weeks after. It's very, very important.
No,
Otherwise,
they have to quit like altogether.
look, ideally altogether, and if they can't quit, then they have to sign a consent that they have a increased risk of infection, of failure, and so on. And that's with any surgery. It actually delays healing, increases risk of infection. So as a doctor, why would we want to take the risk? Why would we want we want patients to have excellent outcomes. We don't want them to have bad outcomes. So that's definitely that's correct. But just circling back to heart attacks, another story, another anecdote. When I was actually a junior doctor in the hospital system, I remember there was a young, not a young, maybe in his 40s, 50s.
Which is young.
Which is relatively young, considering that people are living into their 80s and 90s these days. A guy, he looked pretty like muscular, a little bit overweight, and he came in and he's like, I have reflux. And he's like, I've got really bad burning sensation in my chest. And, just a routine, because he mentioned in his chest, routine investigation in the hospitals, bloods, ECG. And it turned out he was having a massive heart attack. And I found that quite interesting. And he survived and everything was okay. And he went up and they did an angiogram and stents and so on. However, you'd be surprised. Heart attacks can appear in many different ways. Some people will describe it. The typical symptom is a sensation of something very heavy on your chest or crushing on your chest. Patients will describe feeling like someone's sitting on their chest.
Well, we've heard stories. People, they come home, they tell, I'm not feeling well. I think I'm going to lie down. And they just never wake up.
Yeah, so that's a typical, is the crushing sensation, heavy chest pain, left-sided, radiating to your arm or jaw. That's the typical. However, there is many atypical presentations. Like you said, if you're just feeling unwell,
Fatigue.
a bit of feeling like a bit of
I think a headache or something.
epigastric or like upper abdominal pain, just arm pain. So if it's something that's unusual, it's persisting, and you're concerned about it, definitely seek medical attention. And especially if you're at high risk, then you should seek urgent medical attention. But prevention is always better than cure, and that's what we're focusing on, which is that heart attacks have become extremely common in the community and in the general Australian public. And how can we prevent that? Is by being healthy, by losing weight, really by quitting smoking, by controlling our diabetes.
Even when they come out of hospital, they put them on a rehab program, which is exercise, and a feeding program, which is diet.
That's right.
Medication is somewhat part of it.
That's right.
But generally, the biggest part of the post treatment is exercise and
that's
and
100.
diet.
That's 100% right. And the focus on the medications will be anti-cholesterol, anti-blood pressure medications. If you're diabetes medications, and a variety of others like blood thinners and so on, antiplatelets. So once you've had a heart attack, you've kind of destined yourself to be on at least 4 to 5 medications for the rest of your life. So try to prevent that from happening.
Right.
And if you don't like medications, the only way to prevent that, or the main way to prevent that, is by not smoking, by losing weight, by being healthy, by exercising.
Take the means.
Take the means, exactly. You have the means available. It's not uncommon knowledge. And with smoking, there is medications that can help you stop as well. You know,
There's alhamdulillah, a lot of people I've heard have quit.
there's people quit cold turkey. Kudos to them. That's fantastic. If you can, you know, like that's amazing. And Ramadan is an excellent time to enhance your discipline. If you can withhold from the basic essentials of life like food and water, then you can surely you can also withhold from other vices. But if you can't quit cold turkey, then things like there's nicotine patches, there's other medications like Champix, and then also, believe it or not, there's a very important therapy such as cognitive behavioral therapy, where patients will actually see a psychologist on a regular basis and discuss their smoking habit. And they will actually motivationally interview them and encourage them to quit. And that's something
What about hypnosis?
Yeah, look, even like some patients.
I've heard some they work.
I've heard stories that it works as well. So I'm not opposed to any alternative therapies as long as it doesn't contradict or harm.
Obviously, Islam.
Yeah.
SubhanAllah. I think this is important because people don't know the link between it. So we mentioned about obesity. We're just breezing through because obviously there's a lot. Diabetes and heart attacks. Because sometimes people, when they take a blood pressure, right? Sometimes the doctor freaks out and says, your blood pressure is too high. How does that tie into everything, the blood pressure side of things?
Oh, that's a good question. So I think there's a few metrics that as a GP I measure on my patients to see their cardiovascular fitness. BMI, which is your height and weight, and it's a calculation that we do. That's one factor. Blood pressure is another factor. Cholesterol in the blood test is another factor. Sugar level, HbA1c, your 3-month sugar, is another factor. And then there's a variety of other factors that we can use. When it comes to blood pressure, again, with most things in medicine, there's a genetic component and then there's a lifestyle component. And it's the same thing with blood pressure. Now, there is a phenomenon called, and I've used that word a lot of times, phenomenon today actually, but there's a phenomenon called white coat hypertension, which means that as soon as you come to the doctor, your blood pressure's high. And that's because you're a little bit nervous. Maybe the doctor has poor bedside manner, or you've waited a long time in the waiting room and you're quite frustrated. So that can, in and of itself, sometimes cause a false elevation in blood pressure. So that's why it's always advisable if you're at risk of high blood pressure. If you have high blood pressure, buy a blood pressure machine. It's like $100 online from your local pharmacy. Drop by your local pharmacy for less and grab one and monitor it at home. Or your doctor can actually recommend a 24-hour blood pressure monitor, and that can always help give you an average. But what was your initial question?
I say, how does it contribute to everything that we discussed?
Yeah.
Why? Because I'll give you an example, right? I do recall once someone called the ambulance. It was at university. There was an exam. One of the guys passed out. And then they called the ambulance, and the ambulance came in. They set him on the chair. They took his blood pressure, and they turned around and said, listen, your blood pressure is normal. I remember their words were, we can put you in the yellow and, the white and red ambulance and take you to the hospital, but everything seems fine.
Mm-hmm.
So they looked at his blood pressure and obviously his pulse.
Mm.
And to them, that was enough for them to decide it's not an emergency.
Look, it depends on the context and the presentation.
Yeah.
Every scenario is different. And you can have problems with low blood pressure. You can have problems with high blood pressure. For example, a lot of people come in lightheaded, and one of the causes, especially in women, would be low blood pressure. And there's another thing called postural hypertension, where when people stand up quickly, if they're for a variety of reasons, their blood pressure drops and they get dizzy.
If I have high blood pressure, I'm calm, I'm relaxed, I didn't have any problems in the waiting room. I came and I saw you, and my blood pressure was high.
Mm-hmm.
And then you say, listen, let's take it after an hour. You took it. It's too high.
Mm-hmm.
What is that? I guess because all I'm trying to say is diabetes is a sugar thing. We know what the other things, but what does that signify? Me having a high blood pressure, what am I at risk of? What's the outcome of it? Am I gonna just fall and die? Am I gonna get dizzy?
I understand.
What's the
Excellent question. So similar to the other conditions we talked about, it also contributes to cardiovascular disease and cerebrovascular disease. So it can contribute, if it's uncontrolled,
to strokes.
It's a risk factor to strokes, to heart attacks, and so on. Definitely. And if it's too high, it can in and of itself cause a stroke. So, we have something called a hypertensive emergency, where someone's blood pressure is very, very high, above 220. And that's an emergency. You have to go to the hospital and get treated immediately because you're at a very high risk of having a stroke. So generally speaking, if a patient has slightly high blood pressure, we can talk about lifestyle modification and addressing it with your lifestyle, reducing stress, improving sleep, Things like sleep apnea can also contribute to it. So addressing things like sleep apnea, losing weight, reducing salt in their diet, and a variety of other factors.
And it's also stress.
Yeah,
Stress
definitely. Look, we talked about all of those things. I think stress, I would lump that in with there as one of the contributing factors to many diseases. It's something that's unfortunately very bad for you, and something that I guess what I always tell people is you can't control the stressful events that happen in life, but you can control your perspective and your reaction and your response. And that's imperative. And there are different ways to help control stress. One is your faith and your iman and tawakkul and so on. That's quite important, your perspective of life. Another one would be things like exercise. When you exercise, it helps control, mitigate, reduce the stress. Number 3 is having a good support network. And then number 4, also having a good, a psychologist, a counselor, a life coach, someone to open up to. Definitely, your local doctor, someone to open up to and help release that stress with. But back to answer your question with hypertension and high blood pressure, it can definitely contribute to all those diseases. And if it's a little bit high, control it with lifestyle factors. Otherwise, you do require medication.
to bring it down.
And it can, it doesn't only cause
Can
those.
it be genetic? Like just someone just has.
Yes, definitely, yeah.
That's just how it is in the family. Everyone just
Definitely, yeah. That not only some people unfortunately are dealt with very difficult genetics, and they just have familial hypercholesterolemia where they have very high cholesterol. They can't control it even with their diet, and they have to be on medication. Some people just have a propensity to develop very high blood pressure without any lifestyle factors causing it, and that's why it's also important to screen for secondary causes of hypertension. So there are some medical conditions that can cause hypertension.
like infections and things like that.
A variety of different things. Pathology involving the kidney. So something like renal artery stenosis. There's hormonal causes. There's a variety of different factors that can cause it. So anyone that comes to me with hypertension at a young age, unexplained,
Renal.
we always do a secondary screen.
Yeah.
And sometimes we'll refer to a renal specialist to further investigate.
And just so we can mention, which is the specialist that deals with obesity?
Mm-hmm.
It's an endocrinologist, yeah?
So your general practitioner should definitely be able to assist you with obesity. If there is a hormonal cause and contributing factor, then an endocrinologist will definitely be the best suited specialist to address that as well. Definitely.
And for obviously it's cardiologist.
Cardiologist, yeah, definitely. We have quite
obesity.
a few
Is there a
very good ones.
specialized? I know that obviously general practitioners do everything, but just so people have an idea.
With
of the
obesity, yeah,
specialty.
you're right. With endocrinologists are quite good with that. Yeah,
So
definitely.
they'll deal with obesity too.
Yeah, definitely,
Yeah.
definitely.
And hypertension. I hear renal is normally the
That's
renal
right.
doctors.
Yeah. So renal physicians or cardiologists as well.
SubhanAllah.
Yeah.
One thing, the last one I want to mention in regards to these metabolic diseases that are related, obviously, to what you ate and things like that, because some people mention good cholesterol, bad cholesterol. That say. So what is high cholesterol? What's good cholesterol? What's bad cholesterol? Sometimes the doctor will look at the result and say cholesterol is high, but it's the good one. You know what I mean? Can you explain that a little
Further
bit? First,
elaborate,
like, what's the problem with it? Because obviously sometimes they say, oh, it's high, but it's the good one, not the bad one. You know what I mean?
When we test cholesterol, usually there's a few different subsets that we can look at, and there's generally the overall cholesterol. Then you have your lipid studies. So you have your HDL, LDL, and then you have your triglycerides. And usually, if the overall cholesterol is high, that's probably the number that I look at the most. That and triglycerides. If the overall cholesterol is high, then there's something that we have to do to address that. Also, the triglycerides, if they're high, we have to also try to address that. There are some simple, lifestyle things, changing your lifestyle habits, reducing eating fatty meats.
And this all relates to stroke and
exercise
heart
can all
attacks,
help.
yeah?
Oh, definitely. They definitely contribute to cardiovascular and cerebrovascular disease.
So high cholesterol is the sign of everything that we can. So you risk high cholesterol, you risk of diabetes, you risk of hypertension, you risk of
I would
heart
say
attacks. It's like an indicator.
It's an independent risk factor. Yeah. That is linked to those diseases, exactly. There is one subset, HDL, which we consider as a good cholesterol,
Good one.
right? But just generally, the most important one that I personally look at is the triglycerides and the total cholesterol, and we try to reduce them overall. Often, and this is another very, very common thing that I see, patients with high cholesterol, and it's very, very common in my practice in here, Southwest Sydney. we see a lot of fatty liver, hepatic steatosis, and it's something that you need to address as well, because that can have long-term harmful effects too.
Because it affects obviously the function of the.
Eventually, yeah, it can cause if very poorly controlled and severe, it can cause things like cirrhosis and liver failure. Yeah, so it's definitely something to address.
I remember that subhanAllah, they were saying, especially with the Mediterranean diet, which is us, and the Lebanese
Supposed to be us.
genetics, we have a problem with fatty liver and cholesterol.
Ah, yeah.
Is
okay,
what I found,
yeah.
because you look at a lot of carbohydrates. Everything's like today, if we look at, I was eating fatteh, so that's chickpeas, carbohydrates. It's got in it bread, carbohydrates. You know what I mean? And you know, everything else that you're having around it. Some people.
You had meat in there somewhere for
sometimes meat. No, we don't. Generally, some people have meat, some without meat.
Did you have meat at iftar tonight?
No, not today.
Nothing?
Oh yeah, there was like pizza. So
yeah.
my mum, Allah yahmiha. But yeah, so yeah, generally our diet does have a lot of oil. You think about the kibbeh and oil on top of it, or pretty much everything's got oil in it. So yeah, that plays a big factor when it comes to cholesterol.
I think every family, the person that's responsible for cooking in the family should at least do 5 to 10 sessions with a dietitian, because their role in the whole family's health is critical. We as a community, as individual families, we're responsible for everyone else in the family, and I think we need to make some big lifestyle changes, because unfortunately, obese parents are more likely to have obese children, and the habits, the poor lifestyle habits that you have, pass on to your children and onto your grandchildren. So you're causing you can cause generational damage by neglecting your health.
SubhanAllah. I really want to go into these other topics. We do have 2 other topics that we do want to go into, but I think we've got some questions, and we don't want to drag obviously the time too long.
No problem.
But inshallah, you'll be on again soon.
Sounds good.
Which we're going to talk about hair loss.
Hair loss is a big one.
Being a hair transplant doctor, SubhanAllah, we have a lot of insights into that, and because within our community, it's not hard if you're praying in salah, just look upon the heads of the brothers, and inshallah you find that hair loss is
very common.
Is huge, and people don't sort of understand that it's with males and with females.
Definitely.
And there are things you can do other than transplant. There are medications.
Yeah.
There is an option of transplant, and for those that don't know, surprisingly, scholars spoke about transplanting hair from one part of the body to another. Obviously, because it's from your own body, right? It
has to be from your own body.
Yeah, from another body for necessity, I guess that's a different story. But we're talking about from your own self to replace what was already there.
That's interesting.
You know what I mean? Which is obviously is allowed.
That's fascinating.
You know
so they spoke about that.
It's quite interesting, because I remember seeing when they came to these fatwas, I was talking about transplanting tissue and hair from one part of a body to another, to your own body.
Wow.
So like, for example, skin grafts.
That's fascinating, yeah.
You know what I mean?
That's
and things like that. So that's very interesting.
Cool.
So in a way that in Islam, if there is a change in your due to a disease, because it is a disease, it's called alopecia, right? It's actually a medical condition. There is treatment for it. So there is a type of treatment for it, and we can go through that inshallah in the near future, and the experiences that you've gone through. I think it'll be very interesting.
Sounds good.
Because a lot of people, again, they don't understand different techniques, different processes, and mental health.
Oh, it's a very big one.
That's a very important one.
Definitely.
And I think that will contribute or benefit a lot of people.
Definitely.
Inshallah. But we just got some questions here.
Let's go through them.
All right. The first one, Ozempic.
Ah, yes.
They said, is it safe to use?
The wonder drug.
Is that for obesity?
Yeah. So, all right. How about we'll go back to like first principles. So, if you suffer from obesity, you should seek out medical advice and seek out medical professionals, a doctor, dietitian, exercise physiologist. Okay, that's number one. Number two, lifestyle changes. Nothing replaces lifestyle changes. There is no drug, there's no surgery that will replace lifestyle changes, because they all cause temporary weight loss. They all cause temporary weight loss. And so all these people get yo-yo weight loss. They go on a drug, they get a surgery, and unfortunately, majority of them will gain the weight back if they don't maintain the lifestyle changes that they have to maintain. So there's nothing that will replace. There's no shortcut. We all love shortcuts. You know, there's a movie called Limitless where he takes a pill and he just becomes a genius.
Yeah.
There's no. This is only in.
Did you prescribe that?
I wish if I had it, I'd be taking it. It's this is only in Hollywood. Okay, so there's no shortcuts in life, and whenever we try to take shortcuts, we end up being disappointed. Okay, and that's also with investments as well. There's no shortcuts. That's a big one for the community too. So with obesity, we said number 1, seek out advice. Number 2, lifestyle changes, healthy diet long term, exercise long term. Aim for sustainable weight loss. Okay, that's the key. Sustainable weight loss.
So if I'm just saying, like someone that's put on weight, it might be a practical case where it might take 2 or 3 years to.
Look, it could take depending on the circumstances for sure. But you want to do long-term, sustainable, maintainable weight loss. You don't want to just drop and regain it back on again. Okay. Now, when it comes to medications, now this is the question. There's a variety of different medications. There's some medications such as a medication called Duramine, which is a stimulant. And it helps you. It increases your metabolic rate, and it can help you lose weight. There's another medication called Contrave that also can help you lose weight. And then now there's this class of drugs, these GLP-1 medications that were initially invented to treat diabetes, and they found that they helped cause large amounts of weight loss and a significant amount of weight loss. And they were used in Hollywood, they were used around the world. Yeah. They became famous on TikTok, on Reddit.
I think diabetic patients were going crazy because they were
That's right.
They're running out
That's right. Yeah. So there's an ethical concern with prescribing it now as well. Because if I have 2 patients, one that needs it for their survival and for their diabetes and to prevent them from getting severe complications, and one that wants it for weight loss, ethically, I am obliged to give it to the patient that needs it for their safety and well-being, right? So there is an ethical component, and I think that most people don't. Unfortunately, most people just think about their own well-being, and you have to realize that Ozempic is not just a magic drug that will fix all your problems. No. Right now there is a bit of a shortage in the pharmacies, and pharmacists will prioritize, and doctors will prioritize giving it to diabetic patients that need it. So that's number 1. Now, number 2, is it safe? So every medication, you should never start a medication without seeking advice from your doctor who understands you, who knows you, who's done your blood test, who understands your medical history.
You're telling people that might be able to get it on the black market.
Oh, definitely.
Cautious.
Everything is available on the black market, and nothing should be taken from the black market. It's just risky. There's a reason why things are done in Australia. We talk about any medical procedure, medications. You want things to be regulated, to be monitored, to be done in a safe, sterile environment, to be understood clearly, the pros and the cons. You want to discuss with someone the pros and the cons. So that's very important. So that's one thing that. When it's prescribed from a doctor, is it safe? There are always risks with every medication. There's always risks, there's always side effects. Okay? So there are common side effects. Some people get gastrointestinal side effects. Some people feel very nauseous. Some people get bloating. Some people get diarrhea and so on. Some people don't tolerate it. Some people get a variety of other mild complications. Some people don't experience any complications. But recently there's been some concern in regards to thyroid issues, long-term thyroid issues with Ozempic, and so I don't tend to prescribe it for patients with thyroid issues. And if I am concerned with their thyroid history, then I'll send them to an endocrinologist to discuss. In animal studies, there has been shown that there's a very small link. There's a small link to cancer, and you can actually see this if you Google it, Ozempic, and you type in thyroid, and it's actually on the Ozempic website. So so it's something that you should consider. It's not every medication you take has potential side effects,
but you want it to be underneath the eye of your doctor.
You want it to be monitored. You want it to be observed. You want to have follow up. And look, now we've talked about the potential negative side effects. Now, on the positive side, it does cause significant weight loss. It suppresses your appetite significantly. And I've seen some people lose, 10, 15 kilos, 10% of their, 5 to 10% of their body weight. So it definitely can help with weight loss. However, when stopping it, if you don't maintain lifestyle
It comes
changes,
straight away.
if you just go back to overeating, you will gain the weight back. So it's not a magic cure.
Mm.
That was a long answer to the simple question.
No, people need to understand, like, it's just not just taking the medication and
No, definitely not. It's not. It's not just a one hit magic cure. No.
SubhanAllah. If someone's on long-term opioids for pain, epilepsy, they've mentioned here, should there be any precautions taken, like eating before taking? So someone's on long-term opioids. Any precautions?
Look, opioids is a good discussion point as well, and unfortunately, some people do suffer from chronic pain and do require long-term treatments. And the problem with opiate medications is there's some new documentaries about them as well, is that patients often develop dependence and tolerance, and so they end up requiring to take it even after the pain subsides.
Yeah.
As well as they become tolerant to it, so they require higher and higher dosages. That's not the question, but and probably not for this person, but as a general principle, people should be aware of these principles and should be cautious when taking opiates.
Generally, isn't opioids always supposed to be a short to medium term sort of, and it shouldn't be something someone should become reliant on?
In majority of cases, that's correct. Unfortunately, some people do suffer from chronic pain for different reasons, and therefore they should see a pain specialist. And if they prescribe something long term, then under monitoring, and it should be the minimal dosage possible and try to be reduced and weaned off as much as possible. There are some unfortunate circumstances.
You said pain specialist, so we're talking about, for those that don't know, there are specialists called pain management specialists or management clinics that their whole goal is to manage your pain in the most effective
That's correct.
way possible.
And there's different medications out there that can help with pain. And there's a pain ladder, and you should always start with simple things like Panadol Osteo. Then you go to, in some circumstances where you can tolerate it, non-steroidal anti-inflammatory drugs, your Celebrex, your Mobic, your Nurofen, and then your opiates as a last line. And then there's other medications as well, even some antidepressants such as amitriptyline, Endep, and Cymbalta, duloxetine. They can help with chronic pain. Now, but to answer this person's question about being on it long term and was it about eating?
No, it was about pain. Oh, which one? Sorry.
About the epilepsy.
No, it mentioned about pain.
Yeah. What was their question though? Do I have to?
Any precautions? Like, should they, like eating before taking it? Is there any precautions to be?
In regards to like when to take medication, like before, after meals, and so on, it's best to consult with their pharmacist.
Because each medication
is different, so best to consult with their pharmacist. I would advise them to always have a good allied health team and a good psychologist, because a lot of chronic pain there's a psychological component as well, believe it or not. So psychologists are critical. A good psychologist is worth their weight in gold.
I just wanted to ask, I don't want to chuck
and an exercise program. So things like hydrotherapy for back pain is very good.
That's very beneficial.
Long-term exercises and stretches that you're advised.
Jamal knows about hydro. He's spoiled. He has the heated hydro.
Oh, in his own house? Okay, well.
No, somewhere he goes to.
Nice.
Warm heated hydro.
Nice, and that's the best kind, yeah.
SubhanAllah. Don't want to put a spanner in the works, but when we talk about opioids, we're talking about like pretty much heroin is derived from the same. And we accept that now there's a new form of treatment that has sort of been more acceptable. You know exactly what I'm talking about. And I've heard good feedback from patients, and which is accessible cannabis oil. What does that fall into pain management? How good is that? Because now it is accessible through
very accessible now.
Through like
through doctors who have some extra training in that sector.
So how good is it as a painkiller when compared to
these kind of medications? Look, it's not my I haven't subspecialized into it. It's not something that I prescribe. I refer patients on to CBD clinics when they're after it. Similar to you, I have heard some mixed feedback, some very positive feedback of patients that find that it helped them a lot, where other medications didn't. And then I also hear negative feedback where patients didn't find that it helped. And there's different forms. There's forms where there's two components, there's CBD, THC, and you can change the components to obtain the required effect. But I would always advise them to just, seek advice from a doctor who specializes in it and discuss the pros and cons, and go from there.
I think that's important because dosage and the milligrams and all that stuff, it's prescribed. It's a prescribed
It's
medication.
a prescribed medication. It's a very regulated medication. It's and it has many different indications. So there's people that take it for that they can't, like severe insomnia. There's patients that take it for severe depression. There's patients that take it for severe pain. So and each has their own formula, different dosages and so on. So yeah, definitely I wouldn't be just experimenting on my own. Definitely not.
SubhanAllah. Unfortunately, these days people think they can get it off the black market and give it a go, as they say. In general, with everything that we've spoken about, I think it's very, very important to understand that. I remember I was watching a documentary and they said the biggest change we've had in this type of civilization is one product. People said oil. They said no. People said filtered water. No. Everyone's trying to have a guess. What is the biggest change in our that's caused our modern civilization? And people couldn't guess it. And the answer was very strange. The answer was fertilizer. Everyone started scratching their head. What do they mean by fertilizer? How's that changed our life? It's because it's able or allowed people to grow far more crops and far more food has become available for consumption, which in turn has caused a vast spread of food. You know what I mean? Before, if you realize villages, places, people used to settle next to farmland, next to, wells, and civilization was like that for a very long time. But they said we've able to grow, and not just that, able to grow food, not just in season, but all year round. And fertilizer, which is instead of growing something in 6 months or 3 months, it grows in 2 or 3 weeks. Food has become more available and become accessible, cheaper, which in turn has allowed people to consume it more.
Yeah, no, definitely. And it's interesting. Technology is always a blessing and a curse. I never used to. Uber Eats has been around for a while, and Didi and what is it, Menulog and all of these kind of apps, and they make things very convenient, too convenient. Instead of sometimes you'll just go hungry at night and you won't have anything, or you'll just make do with whatever you have in the fridge. Now you can just at the edge of at the touch of your fingertips, you can order a 3-course meal and dessert, and drinks. So like you said, it's accessibility has become a bit of a problem. That's right.
And one last question, because this is something we actually mentioned the other day. We want to clarify it from the medical perspective. When you eat something you may not know, but when you eat and when your stomach becomes full, sometimes people have said that there's a delay between your stomach and your mind to say, okay, I'm full, stop eating.
Definitely.
Is that a myth?
No, that's true. Definitely. You just experience it, and that's why, it's always good to have something have something small and eat slowly, chew your food and allow it to digest and allow your body to recognize it. And you'll notice that when you eat very quickly, you'll eat a lot more. Whereas when you slow down your meal and you take gaps and you're having conversation, you'll eat a lot less. So yeah, definitely there is a gap, and just going intense and eating as much as you can in as short period of time as you can is definitely not advisable. That's why buffets are never a great option, because you try to get your money's worth, and that's not what you want to do. You want to eat as little as possible to make you a healthy portion to make you content.
Inshallah. Allah subhanahu wa ta'ala reward you. Jazakallah khair, Dr. Yusuf, for this beautiful program. Inshallah, the listeners benefited a lot.
Inshallah.
And we do want to cover those 2 other very, very important topics in regards to hair loss and mental health, which is, I'd say a huge problem. Very, very big problem. I think it affects every single household in Australia and in the world, no doubt. SubhanAllah, Allah make it easy. So inshallah, that's coming up soon in the next week or 2. May Allah reward you.
Thank you very much for having me.
No worries, inshallah. Anytime. Jazakallah khair. Thank you for tuning in.